I put this one as a differential diagnosis for basal cell because usually you will also have this kind of lesion. Usually happen this this is called trichoepithelioma, usually in the head and neck face area. Why we do not think this is basal cell? First, usually these benign tumor do not have do not attack the epidermis, so it's just stay in the dermis. And then when you look at the stroma, it's kind of different from the mucinous bluish stroma of the basal cell. You can see this is a hair follicle, so the stroma just like pink, not bluish, just like the normal stroma around the normal hair follicle. So this is, and then the cell kind of look like basal cell carcinoma, but they look really blank. In basal cell carcinoma, usually you can find kind of atypia and also some mitotic figure in the basal cell carcinoma. But in this benign entity, you usually do not see that. And then we need to find, some people may say, oh, this is retraction side effect. But when you look more detail, actually it's not. This kind of subtraction just between the stroma, not the stroma and the basaloid nodule, not the stroma with the basaloid cell. So this is not truly retraction side effect. And then there is classic feature why we are sure this is trichoepithelioma, because we have this kind of structure, basaloid cell surrounding by this spindly mesenchymal fibroblast-like cell. We call this mesenchymal papillary mesenchymal body. When we have this papillary mesenchymal body, that is trichoepithelioma. But whatever, if you diagnose something like basal cell for a trichoepithelioma, I think even you have this kind of nodule in your face, you still want to take it out. But remember, papillary mesenchymal body, that is this basaloid cell hugging by this spindle fibroblast-like cell. That is a classic feature. When you see this feature, you are sure that is not basal cell carcinoma, papillary mesenchymal body. If you're really not sure, you can do one staining to help you. That is CK20. CK20 can highlight the passenger Merkel cell, because in benign lesion, there should be some Merkel cell around. So when you do CK20, you can highlight single individual CK20 positive mesenchymal passenger Merkel cell around. That is really good for a benign entity trichoepithelioma. And the other people will also kind of confused with trichoblastoma. Actually, trichoepithelioma and trichoblastoma, they are in the same family. For me, if we can see kind of like small lesion like this one, I would say this is trichoepithelioma in the superficial dermis. This is another one, trichoepithelioma. Even in low power, even we see this basaloid nodule, but this pinkish stroma really take you apart from basal cell carcinoma. And then this is retraction side effect, not as similar as the basal cell carcinoma. This is not true retraction side effect, because this retraction is between the stroma, not between the basaloid cell and the pinkish stroma. Then we want to see our friends papillary mesenchymal body. This one is really nice basaloid cell hugging by this spindle fibroblast-like cell, papillary mesenchymal body. And then remember, we can do CK20 to highlight the passenger Merkel cell. Here, the reason I want to show you this one, because the name looks like really similar. This one is desmoplastic trichoepithelioma. Even they have the same name of trichoepithelioma, but in the microscope they are totally different, because desmoplastic trichoep fall into the tadpole pattern. I think we will have that typo pattern differential diagnosis in later cases. This is the Pathology-Li or tadpole pattern. That is this line structure. Tadpole, we have the head and then we have the tail. We have the head and then we have the tail. Somewhat like this, if you have the head and then you have the tail, this is the Pathology-Li pattern. When you have this pattern, we call this desmoplastic trichoep. Because for this pattern, there are several differential diagnoses. One is basal cell carcinoma. The other one, desmoplastic trichoep. Third one should be syringoma. And then the fourth is macrocystic adnexal carcinoma. How could you tell them apart? First, for desmoplastic trichoep, you do not see perfectly like this one and then with a tail. You usually do not see that. That is one feature for desmoplastic trichoep. Sometimes you will see calcification, those we do not see here. And then this lesion do not go down deep and then kind of well circumscribed. If you go really down deep, even into the muscle and subcutaneous, that is macrocystic adnexal carcinoma. But even like this, if you have this lesion, you still want to take it out because usually it's really broad shape and then really not really to tell them apart. So this one just for your information, like desmoplastic trichoep is not similar to just trichoepithelioma.